All right, so we are here for our second meeting for Comprehensive Primary Care Plus, or CPC Plus, and this is information for clinics who have been approved as CPC Plus clinics. Here's our agenda for today. Some of this is a little bit of a repeat that we'll move through fairly quickly. We are going to talk a little bit about Medicaid enrollment. We'll talk about the Medicaid Management Information System Provider Web Portal, gaining access to that portal, what you need to do on that portal once you have access. We'll talk about the patient list template and how to upload that list. Enrollment and error reports. We're going to introduce some information today on the per member per month payments that we haven't talked about yet. We're also going to talk about PCPCH recognition. That's patient-centered primary care home, and the 2017 standards for PCPCH recognition. And we'll also talk a little bit about CPC Plus contracts between OHA and the practices. Okay, so let's start off with Medicaid enrollment. Again, this is a little bit of a review, so we'll move kind of quickly through this. CPC Plus practices need to be Medicaid enrolled, and they need to have a National Provider Identifier, NPI. Enrollment allows the practice to upload their patient lists and get paid the per member per month payments. So there is no deadline to enroll. The enrollment process can take some time, so don't worry that you're going to miss a deadline to do that. And MMIS pays retroactively for the patient list upload. So we don't want you to feel like, oh no, the enrollment hasn't gone through yet. Don't worry, it will be retroactive. At the bottom of the page, you'll see the link to the provider enrollment page if you have additional questions after today. Also, you can ask Jamal any questions you have about enrollment. Okay, so most of the practices are already enrolled. They already have a Medicaid ID that's associated with CPC Plus, but there are some practices that are not yet enrolled. And if you're one of those practices, or if you work for one of those practices, you should have received an email from Jamal stating that you need to enroll. And Jamal is also going to let each CPC Plus practice know which Medicaid ID, maybe you have more than one, but he's going to let you know which one is associated with the CPC Plus program so that you know which one to work under in the MMIS Provider Web Portal to upload your patient lists. Okay, so a little bit about how to enroll with Medicaid. So you can apply for or look up your NPI if you need to. And then you would apply for enrollment as a billing provider if you're not already enrolled. That's a provider type 09 in our MMIS. Excuse me, we do have provider enrollment online on the provider web portal, or you can submit the OHP enrollment forms. And we also have a team of people that's dedicated to provider enrollment, and you can reach them at this 800 number or via email. All right, so also part of our review, excuse me, we're going to talk a little bit about the provider web portal and how to access that and get your account set up. So the CPC Plus representative needs to have access to the web portal. That allows them to upload the patient list and also to monitor fee-for-service patient enrollments and payments. So you'll see that we associate some different tabs to that. The patient list will be uploaded under the Trade Files tab. And when you're monitoring the patient enrollments and payments, you'll be looking under the PCPCH tab. And under that tab, there are a few different options. So we have Client PMPM Attestation and Client PMPM History. And you'll be able to look at that information there. So the next bullet is really just a repeat of that. So the required clerk roles for CPC Plus are Trade Files and PCPCH. Go ahead, Jamal.
Yeah, just a quick correction on where to find the Client PMPM Attestation and Client PMPM History options on the Provider Web Portal. That'll actually be under the Provider tab, where to find those options. And again, those are the options that will allow you to view the payments for your fee-for-service members, either by using the check number, using the month of the payment that you're looking for, or by individual recipients and then the client PMPM attestation allows you to view the actual enrollments of those members and to make sure that from the patient list that you uploaded, each of those members made it in for or were enrolled into the CPC Plus program for the time frame that you specified.
All right, thank you for that. And that actually makes me think about some changes that I might need to make to the slideshow before I send it out to everyone. So just so you know, I didn't send it out yet. I typically send it before the training, but just in case we have a couple of those little changes along the way, I thought maybe I could make those changes and send it to you right after. All right, so more about the Provider Web Portal. Every Medicaid provider or practice that's enrolled with us at OHP can have access to the Provider Web Portal. So initial access does require a PIN that we issue upon provider enrollment or practice enrollment, whatever you want to call it. So newly enrolled providers and practices receive this a few days after their enrollment process is completed. So if you're already enrolled with us and you have been for a long time, this probably happened a long time ago. You may already have access to the Provider Web Portal. If you don't, there are a couple of reasons why you wouldn't. First of all, it could be that the practice didn't set up the Provider Web Portal account at that time. If that's the case and there is no initial account, you'll need that PIN letter, and you can get that from Provider Services Unit. Now, another reason that you specifically may not have access is because the account administrator that set up that initial access just didn't set you up yet with as a clerk for the Provider Web Portal. So if that's the case, then you need to get in contact with the administrator at your office to get access to the Provider Web Portal under this CPC Plus ID. If you're not sure who that is and you don't have access, that's another thing that you can find out from Provider Services Unit. They can tell you exactly who the administrator is on the account. And then you'll find our MMIS Provider Web Portal guides on the website. So there's a website at the bottom of the page there. And these screenshots that you're going to look at right here are actually from some of those guides. So just so you have an idea of what those guides look like. If you're setting up the account for the first time, you would go under Account and click Account Setup. The login ID is the 6 or 9-digit Medicaid ID, and then the PIN is on that PIN letter that's issued right after enrollment or per request if you've already been enrolled for a long time. And then you click the Setup Account button, and then there's lots of fields. All the fields are required. Your username cannot be the same as the provider name, or it also can't be the first name or last name of the contact. So, and the username for this initial account setup should be something that has to do with the clinic rather than the person that's setting it up, just because this one is permanent. It stays with the practice forever. And then contact last name and first name, this is the account administrator that would be setting this initial account up. So if this process has already happened, we can look up and see who that is. But you would go ahead if you're setting up and fill out all of these fields. Just know that the secret question fields don't accept any punctuation, so it would just be like color of sky without the question mark. And then the step I always seem to forget is to check the I agree box. That's number 2 down at the bottom left, and then click Submit.
And just another quick confirmation on this. When we initially started to review the list of CPC Plus selected practices from CMS, in our initial review we found that 129 of the 159 CPC Plus practices were already Medicaid enrolled. So once again, this is the process to Medicaid enroll. That's only needed for a few of the CPC Plus practices out there, and if that is needed, you should have received an email from myself indicating which practices needed to Medicaid enroll.
Great. All right, so a little bit more about the Provider Web Portal. If the account already exists, we need to talk a little bit about clerk setup and maintenance. This is the process that would need to happen for the CPC Plus representative. First step is making sure that you're logged in under the correct Medicaid ID. There are some Medicaid IDs that have their initial access to the provider web portal gives them access to more than one provider ID because they are tied somehow together, so that might be the case with you. So if that's needed, you would go to the account menu and switch provider. Excuse me. From there, you select clerk maintenance from the account menu, and then you can add a clerk. You can add someone who already has access to the MMIS provider web portal through some other means, or you can create a clerk from scratch. You want to assign PCPCH and trade files to that clerk, and then click submit. So those are just the steps there, and then the next few slides walk you through that process. So here's our account menu, and you can see both clerk maintenance and switch provider there. And as soon as you log into the provider web portal, if you look at the bottom left under what's new, it tells you the provider ID that you're working under. So that's the Medicaid ID that you're logged into initially. And if that's the correct one, don't even worry about switching provider. Okay, and this is just the process if you did need to switch the Medicaid ID that you're working under. You could also change your default here if you wanted to. Okay, and this is how you would set up a clerk. You would go to the account menu and click clerk maintenance. You would add a clerk, enter their information. You would assign roles from the available roles section and move them over using the arrows under that number 4. And then you would set them up with a temporary password. Again, the roles that you need for CPC Plus functions are PCPCH and trade files. This is if you were updating a clerk that already exists. So maybe the CPC Plus representative at your office already has a provider web portal account, but they don't have the PCPCH or trade files roles. So the account administrator, whether that's you or not, would come in here and assign those roles from the available roles and just move them over using those arrows. All right, so let's talk about the CPC Plus patient list. This is the template form 3131 and how to fill that out and upload it on the portal. So you'll do this once per quarter. Your patient list includes all Medicaid patients that have been served within the last 18 months from that quarter. And you want to upload one quarter at a time. So for example, you would upload January 1st through March 31st, and that would be one patient list. And then your April 1st through June 30th would be a different upload. And then the day after each patient list upload, you'll hear from OHA staff, and they will send you a CPC Plus enrollment report. The upload function is not available right now, but we do expect it to be available by March 1st. So stay tuned for information about that. But this is the process that you'll follow once it is available. So patient list steps. First, you want to find the template on the OHP website. We might talk about this in a little bit more detail, but you don't necessarily have to use our template. We would like you, if you have a CSV file that you want to use or an Excel file that you want to use, you just want to make sure that you're following that same format so that our system recognizes the list.
Yeah, and just another word on that. So the MMIS system, even though a list may be uploaded and it will say upload successful, there's a cycle that runs every night that pulls those patient lists from a queue and determines if it meets the formatting requirements. And so it is important that if you are using your own CSV comma delimited template, that it uses the same columns in the same order that would be represented on the actual 3131 template. And again, you'll want to save that as a CSV comma delimited file. Make sure that there's no non-alphanumeric characters within that file, and some other requirements for the formatting of the patient list that Jennifer will dive into here.
All right, very good. So as Jamal mentioned, this is under appropriately fill out the form. You want alphanumeric throughout the template. You want to, again, report 1 quarter at a time. For each patient, you're going to enter a capital Y in the closure column and a capital X in the ACA qualified column. And then again, you save it as a CSV file. That's the format that the provider web portal will accept. It won't accept an Excel file. So do make sure you do that. And then you would upload the list.
Yeah, and even if you're using your own CSV comma delimited patient list and not the official 3131 template, that could also not have the column headers and just begin with the patient list, the values for the individual patients. As long as it's in the correct order and it's on a CSV template, that should be able to process through the MMIS provider web portal.
All right, so I do have someone asking if we can send out the slides, and I just want to let you know again, yes, absolutely. I usually get them out before the session, but today I didn't get them out quite then because we were still doing some finalizing of the slides. So please don't feel like you have to write everything down that we're saying. If it's on the slide, don't write it down. Just feel like you can make a note of what's on the slide. In addition to what's on the slide is what I mean. All right. Very good. So let's move on from patient list steps. Here is the template, just so you have an idea of what that looks like. So if you use our template, this is exactly what you're going to see. You're going to see one tab with the PMPM template and another tab with the instructions. And again, if you're using your own, that's okay. You just want to make sure that you keep this formatting, keep these columns. And then I did include a link to the forms page where you would be able to type in 3131 and find this template. This is an example of one that I've filled out. And then CPC, if you look under column A, CPC T2, CPC T1, that's just the track. So T2 would be track 2 and T1 would be track 1.
Yeah, so throughout the duration of the program and uploading patient lists, that should be consistent for your practice really throughout the program. So if you're a track 1 CPC plus practice, you'll always indicate CPC T1 within that group type column, and vice versa for track 2 clinics.
All right, so we do have a couple of questions. I'm confused about the patient list. We have to actually type in all this patient data.
So it's really up to the practice in that respect in terms of how to query your electronic health record and place this data in the proper format to be uploaded. We know that some clinics are a little bit more sophisticated in their ability to derive data and manipulate it into this format. And so, but yes, every clinic will need to place the proper data elements for their patients into this patient list template to be able to upload to the provider web portal and begin receiving per member per month payments. I myself and another data analyst are always available to assist in that process. We can help with questions or assisting you and your staff and potential efficiencies in creating that patient list. But to answer the question, yes, each practice will need to complete the template and upload to receive per member per month payments.
All right, the next question I have is, do we need clerk roles for the clinic or for individual providers? And that's going to be for the clinic. So the Medicaid ID that's associated with the CPC Plus practice, that's the ID that you're going to want to give the PCPCH and trade files roles to the representative for.
Right, so when you log into the provider web portal, you'll see in the bottom left-hand corner the Medicaid ID that you're logged in under. And then for that Medicaid ID, you'll want to assign the proper clerk roles to the administrator, or not the administrator, but to the representative at your practice who will be responsible for uploading patient list, operating under the CPC Plus program, maintaining the patient list, checking payments. Those clerk roles will need to be assigned to the particular representative that will be handling that work for each of the Medicaid IDs of your CPC Plus practices. So if your organization has 4 CPC Plus practices selected, you'll want to log in under each of those and assign the proper clerk roles to the person at your clinic who will be managing that work.
All right, just a couple more questions about the patient list. First one is, don't you already know who is assigned to a clinic?
That's a great question. We do have claims data for Medicaid providers. However, we are using the same functionality that was utilized for the patient-centered primary care home incentive payments that were offered back in 2011 through 2013, which is we're really depending on you as the clinics to attest to who your patients are. So you'll be able to log on to the provider web portal, and based on all of the members who had a primary care visit in the prior 18 months, add those members, enroll those members with your practice, and begin receiving per member per month payments. So we'll have an idea as to who your members are based on claims data, but as many of you know, claims data will not tell the complete story. It'll show which patients had a visit at a given point in time, but we won't know, if a patient moved across the state and is no longer in that area, if they've transitioned to another primary care practice. So if there's 2 clinics that serve the same patient within that 18-month look back, we don't want to choose winners and losers on this program, and so it'll really be dependent on the clinic to derive who their patients are, who they served in the prior 18 months, and add those members to their practice through the provider web portal.
All right, next question. Are you looking for patient data for non-CCO, OHP open card patients, or CCO patients?
Yes, so we will only be making per member per month payments for fee-for-service open card members. So those are the Oregon Health Plan members that are not enrolled in a coordinated care organization. And the provider web portal will actually allow enrollment of any Oregon Health Plan member or any member with an Oregon Health Plan ID. The system simply will not make per member per month payments if the member is not fee-for-service for the time frame that they're enrolled. So while we ask for clinics to only enroll fee-for-service members, if you do happen to enroll a CCO member or a fee-for-service member becomes CCO enrolled, you don't necessarily need to manage that churn because the system will already know not to pay for time frames when a member is enrolled in a CCO. It's a great question.
All right, so the next question, and the last one before we move on really quick, is for the last 18 months, for 2017 Q1, does that include all patients that were seen in 2016?
Yes, absolutely. So for the patient list starting this first quarter, we would be looking back from January 1, 2017. So any member with a primary care visit from July 1st, 2015 through December 31st, 2016 are eligible to be enrolled and for your practice to begin receiving per member per month payments for them.
All right, let's go ahead and move on from our patient list sample. So this is how you would upload your patient list. You would go under Trade Files and select Upload. You want to choose PMPM enrollment file under the transaction type. And then you want to click Browse. And you'll find your file. Again, that's a CSV file. That's what the provider web portal will accept. The file name will populate. And then you select Upload on the right. And once you select Upload, the provider web portal will give you a message of whether or not that upload was successful. And that doesn't necessarily mean that...
Yeah,
okay.
so once again here, when you upload the patient list and you see that the upload was successful, that's the first step. It doesn't necessarily mean that the patient list went through the enrollment function and was successfully enrolled. So there's a difference here between a successful upload and a successful enrollment of the patient list. So when you see that the patient list is uploaded successfully, that means that the patient list has successfully made it into the queue to then be analyzed by our enrollment function, which occurs about 6 p.m. every weeknight. So when that enrollment cycle runs, it will determine if the patient list meets the proper formatting requirements, and if it does not, it will reject that patient list, and we'll follow up with an email the next day, or the next morning actually, indicating whether the patient list was successfully enrolled or whether it was rejected due to a formatting error, and we'll be able to provide technical assistance on fixing the patient list to meet the proper formatting requirements. But if it is successfully enrolled, we'll actually follow up with the enrollment report, which then details patient by patient which patients were successfully enrolled, which patients may have been rejected, and the reason why they would be rejected. So situations such as if the member's already enrolled with another CPC Plus practice for the same time period, that may cause a rejection. If you had already added that member and then were attempting to add them again for the same time frame, it would return a rejection for reason code duplicate. So there's a certain reasons why particular individual patient enrollments would be rejected, and we'll always follow up the following day with an enrollment report for those successful enrollments of the patient list, or with an error report for any patient list that's rejected for formatting requirements.
All right, so that is patient list. Everything from here on is new information that we haven't shared yet. So a little bit about CPC Plus reports. Again, I know Jamal just talked about this. So a report on acceptance or rejection of the patient list is sent automatically to the MMIS Provider Web Portal administrator. I do want you to know that the administrator is not necessarily the same person as the CPC Plus representative. If you want this file to come directly to the CPC Plus representative, then that representative needs to become the administrator. And that's something that would be changed. Well, if you don't know who the administrator is, you would need to contact Provider Services Unit, and then that information can be changed. And that's the initial person that set up the initial account on the Provider Web Portal. So that initial account holder is the administrator. Once quarterly data has been reported and accepted, then OHA staff is manually going to send that enrollment report to the CPC Plus contact. So our CPC Plus contact will definitely receive that one directly from staff here. And that will include patient-by-patient information on whether the member was successfully enrolled, and if they weren't successfully enrolled, it would also tell you the reason why they were not. So you could remedy that. So I know Jamal just went over some of that information. And then the next section we're going to talk about, we're going to have Evan, and I'll have you reintroduce yourself here, Evan. He's going to talk about the per member per month payments.
Sure. Just want to make sure everybody can hear me. You can hear me, yes? Excellent.
Yeah,
I can hear you.
Outstanding. Again, I'm Evan Salino. I'm the clinical advisor to the Patient Centered Primary Care Home Program, and I appreciate everybody coming on the webinar bright and early today. Again, CPC Plus, Comprehensive Primary Care Plus, is a multi-payer strategy that is trying to help primary care clinics be able to do advanced primary care work and get off of some of the fee-for-service treadmill that really doesn't work for primary care. It's again an aligned strategy of payments across the different payers. Each payer gets to decide on the exact structure of payments, but the general structure that we're going to go over with these per member per month payments is something that each payer should be following, including, of course, Medicaid fee-for-service. So if we go to the next slide, there are a couple different kinds of per member per month payments that we'll talk about. The first is care management payments, which is really a payment for the comprehensive primary care home services that you have in your clinic that oftentimes are not billable through fee-for-service. And what it allows you to do is to provide some, it's providing some upfront investments so you can have the infrastructure to be able to provide some of these services and to assist practices to continue these transformation efforts, again, in a way that is more sustainable. Payments will be issued basically for each member that is enrolled through the process you just heard about, either through electronic funds transfer or check, however you're set up, and you'll be able to see the payments for each of those clients, each of those patients, those members in the MMIS portal. And if we go on to the next slide. So again, if you're familiar with CPC Plus, your clinic is in either track 1 or track 2. That's the track that you'll stay in for the entire 5-year project. And the track 1 clinics are some of the clinics that are more at the beginning stages of doing this work. The track 2 clinics tend to be the clinics that offer more infrastructure, more robust advanced primary care for more complicated patients. And therefore, the care management payments, the monthly per member per month payments, are different in the track 1 and track 2. For Medicaid fee-for-service, those are aligned with the patient-centered primary care home tiers under the 2017 PCPCH recognition structure. So you see them there. Again, these are monthly payments per person, depending on your tier level for track 1 or track 2. And we can go on to the next slide. So, so those payments that we just talked about are care management payments, again, paying for infrastructure for you to have staff and other things on site to be able to provide this care. Then there's a second type of per member per month payment that is based around performance and trying to incentivize improvements in performance in quality and in utilization, which is really, again, kind of at the heart of what we're trying to do is show a difference in how we give care through this process. So the performance incentive payments, again, which are different than the care management payments we just talked about, a second type of payment. These additional payments will be available based on performance measures that are in the quality metrics that you'll be reporting to CMS on. So CMS, again, in the details of CPC Plus, there are 14 different quality metrics that CMS requires all practices to report on based on their entire population. Those are reported to CMS. And for Medicaid fee-for-service, we're really looking at a subset of those, and we will begin, Medicaid fee-for-service will begin payments for meeting those performance and incentive metrics beginning in beginning in Q4 of 2017. There will also be a separate utilization performance incentive payment. So one based on quality, one based on utilization. And those details we'll be talking about at a future date as we lay out that piece. Again, these payments are going to start beginning to flow in Q4 of this year, 2017. Move on to the next slide. So just to give a little tiny bit of background to sort of take a step back to PCPCH, Patient-Centered Primary Care Home Recognition, and how and why this fits into this whole conversation. So briefly, again, many of you may be familiar with this, but just to review, the Patient-Centered Primary Care Home Program was established by the Oregon Legislature in 2009 with the main goals of creating access to patient-centered high-quality care and to reduce costs by supporting practice transformation. In that House bill, they set out some these goals that the program has really built on over time, and the model was developed both initially and then incrementally over time in collaboration with a stakeholder committee, a standards advisory committee, which is a really a diverse group of volunteer experts from across the state that that provide input and really establish the basis for what makes a patient-centered primary care home, what are the standards and measures that are required to do that work and to reach these different tier levels. So as of right now, under the 2014 measures or model of patient-centered primary care home model, there are 647 practices across the state that are recognized. This is, I think, an incredible number of practices for a program that is a voluntary program. It's about 2/3 of all primary care practices. Just about every county in the state, we're working on that last county, and I think we're going to have a clinic be recognized in that county as well. So we'll have all the counties in Oregon very shortly. That's, you know, a little over 3 million Oregonians that are getting their care through these patient-centered primary care homes. So really an enormous impact across the state. Purposefully, the patient-centered primary care home model aligns very closely with the milestones and structure of CPC Plus. So the work that you're doing for CPC Plus is not going to be something that is completely different or additional to the work that you are trying to do to achieve and maintain your patient-centered primary care home recognition. Those things should be aligned, and you'll actually see as you go through looking through the milestones, you can find corresponding standards or measures in the PCPCH model that really do fit with those CPC Plus milestones. And again, that is intentional. The goal is to not make you do a whole lot of extra work. The idea is that these things really do overlap and that this is synergistic work. And so again, as you're going through, you should find those areas of synergy and hopefully not feel like this is an additional burden for you to work through, but again, actually aligns. Because of the value that has been recognized through patient-centered primary care home work across the state, there was just a wonderful evaluation study that came out of Portland State recently showing some significant cost savings and quality improvements in care. Because of that value that's been recognized and the alignment that's been recognized, all Oregon CPC payers, so Medicaid fee-for-service and the other payers, require that CPC Plus practices achieve and maintain patient-centered primary care home recognition during the course of the CPC Plus project.
Did you have something to add, Jamal?
Yeah, and just to add on to what Evan's saying, it is a requirement that all CPC Plus practices do become recognized under the 2017 standards. So if you haven't already submitted an application for PCPCH recognition under those standards, you'll want to do that as soon as possible. Once you are recognized at one of the 5 tier levels, we'll be able to assign that tier to your practice in the MMIS, and that will allow us to begin accepting patient lists for your clinic and begin to issue the per member per month payments.
Right, and the the proper ones for your tier level. Again, if you think back to that slide that we showed of the different dollar amounts, those are based on your tier level. So correct, Jamal. The 2017, the new 2017 model is what you want to attest to reach one of those 5 tiers to get the appropriate dollar amounts sent to your way. And just again, understanding where this comes from, because the why is very important to this work. We're talking about a lot of details, but we really are interested in this work and engaging you in this work to improve outcomes in patient care and really improve the care that patients give. This is the Patient-Centered Primary Care Home program. Outlines a clinical model of care. It's a clinical model that is based in strong evidence, really robust evidence throughout a number of decades that show us that care that is accessible, care that is well coordinated, care that is comprehensive and continuous, those are 4 of the core attributes of patient-centered primary care home model. That type of care, overwhelming evidence shows us that leads patients to receive better care, to be happier with their care, to the quality of the care improves and patient outcomes improve, and then again we get the winner at the end, which is that costs actually improve as well. There are 2 other core attributes besides the 4 that I mentioned, the accessible, coordinated, comprehensive, and continuous core attributes in the patient-centered primary care home model. There are 2 others that are critical to both the CPC Plus work and our work overall, and those include accountability, so being accountable for the care that you give, trying to make sure that when patients get care in your clinic that they're getting the best care that you can possibly provide that is evidence-based, and that you're thinking about where you're not doing well and trying to improve in those areas. And then care that is patient and family-centered, right? Putting the patient in the center, making sure that we're communicating with them in ways that they understand, that they are empowered to both understand and help manage some of their medical issues, since they're not with us the vast majority of the time in the clinic. And then to engage patients around trying to ask them how we're doing in terms of care, what their experience of care is, and again, where are areas that we can improve and engage them and provide services to them better. So those are the core attributes of the patient-centered primary care home model. Again, very, very, very evidence-based, and really fit with this clinical model of care that is thinking about the whole scope of practice, thinking about the patient in the center, and building really this structure, this home, this place of safety for patients to come to and get the best care possible. So once again, as Jamal pointed out, for CPC Plus practices, you will need to become recognized and maintain recognition under the 2017 criteria. There are a couple of minor changes with the 2017 criteria that are different from the 2014 criteria, which many of you may be recognized under. There were 12 PCPCH standards that were revised by the Standards Advisory Committee that I mentioned previously. There is now 1 additional must-pass measure engaging patients about asking them about their experience of care is the one that was added, and so there are now 11 total must-pass measures, which means that to reach PCPCH recognition at any tier level, these 11 things are things that your clinic needs to be doing. There are 5 levels instead of 3, or 5 tiers instead of 3, and the top level, or most robust clinic level of recognition, is a 5-star recognition. This aligns pretty closely with the 3-star criteria that was in place under the 2014 model of PCPCH. So those things are aligned. There is a webinar coming up next week through the Patient-Centered Primary Care Institute that the PCPCH program is putting on that can give you more information about some of these revisions, some of these changes in a lot more depth. So I would just point you all to that webinar and keep your eyes out for that webinar to listen to me some more and the rest of the PCPCH staff to learn more details about the new 2017, the changes in the 2017 model.
So Evan, this is Jennifer. I just want to make sure that when I send out the slideshow that I might be able to send a registration link to that upcoming webinar. So if you could send that to me, that would be great.
Certainly, will do.
Thank you.
So briefly, applying for PCPCH recognition, if you have not done so before, I would definitely encourage you to start with the PCPCH 2017 Recognition Criteria Technical Specifications and Reporting Guide. There's a link right there on the slide. You can click on it. It is an extensive document that should be able to answer most of your questions. So if you look at some of these things and go, we don't know what we're supposed to do, look at that guide. It will have information about the intent of what is meant what are we trying to accomplish through a standard or measure. It will have information about the documentation required to actually meet that. It will have examples oftentimes of what is meeting the intent, what is not meeting the intent of this measure. And then there are also some best practice boxes where we've seen folks around the state implement things very robustly, really meeting the best of the intent, and so those have been included in the technical specifications, as well as some additional resources. So just in general, start there. It's a dense document, but it's all indexed and everything like that. So you can go through, and if and when you have questions, that should be able to give you your answers. Prepare a document binder, so your information about PCPCH. So put everything in there that you need to support your clinic's application. It's very difficult if you have things spread out all over the place to be able to pull those things together, especially, for example, when you have the program come out and visit your clinic at some point during your recognition, and having all that information together in a binder is going to be very helpful for you to keep track of things and update things when or if you need to reapply, and then again if you receive a site visit. There is an application system that is a web-based application. You just go on there and it's fairly self-explanatory. Again, just to reiterate, CPC Plus clinics, the ability to upload lists for Medicaid fee-for-service, the requirement of need to be recognized and maintain the 2017 recognition for PCPCH, and get payments flowing and all of that. Those things are contingent upon you being able to get your your PCPCH application in and become recognized. So just get those in as soon as possible, and certainly the program will help if you need help to figure things out through, again, this recognition criteria guide, the webinar that I mentioned that's coming up, the PCPCH email, and then there are some online learning modules that are also going to be available soon that can help you think through the PCPCH application process. All of this information is available on the PCPCH website, so the link at the bottom, you can just go there and you can find your way to all of this information.
Great, thank you, Evan. So the rest of the slideshow is really just about a little bit about the CPC Plus contract and then some contacts and resources for you. So we do have about 4 minutes left, and I just want to encourage anyone on the line, if you have questions, go ahead and enter those now. Even if we don't get to your question in the next few minutes, we will have a record of the questions and we'll make sure that we get back to the group with those answers. So question coming in, if our PCPCH recertification is not due until fall, should we still recertify early?
So this is Evan here. Yes, if you, again, for CPC Plus specifically, for Medicaid fee-for-service to be able to start making those payments and have it be in an appropriate dollar amount or an appropriate tier level, then yes, you have to be recognized under those 2017 standards in order to get that stuff flowing. So although you're not due until the fall, I would encourage you to reapply sooner than you're due in order to get this process and the payments flowing.
Thank you, Evan. And I believe that the PCPCH team is also working specifically with CPC Plus practices to backdate the recognition date to January to allow for full per member per month payments under the program. So please do apply as soon as possible.
Right.
Just a little bit of, sorry, Evan, go ahead.
Really quick, just to clarify, yes, so through March, through the end of March, the PCPCH program is given this cushion or this window of time for folks to apply. And correct, as long as you apply through the end of March, then your application will be dated to that time frame, and you will be eligible for the full payments, as Jamal pointed out.
All right, very good. So just a little bit of information on the contract. We're in the process of producing an agreement, and it is expected to be finalized in the near future. And just like PCPCH, each contract will also be backdated to January 1st of 2017, and it's expected to continue for the full cycle through December 31st of 2021.
Yeah, and this is an agreement that was developed through the multi-payer regional collaborative. This will really memorialize much of what we talked about today regarding the payment methodology and the requirements within the state CPC Plus program, and also the broader national requirements through the Centers for Medicaid and Medicare Innovation. So we do expect to finalize that contract and send that out within 2 months here.
All right, and everything else is just resources and upcoming training topics. So upcoming training topics, we have more details about performance incentives, PMPM payments later. Also electronic data interchange, we hope to share that information with you at a later time, and details about the CPC Plus contract. Resources, we have the PCPCH website, OHP forms and publications where you can find that patient list template, and also the MMIS provider web portal. And then of course here are your contacts. We have Jamal listed, and then myself. I'm the Medicaid program trainer, and if you have any questions that don't seem like they fit with Jamal, so maybe they're not about patient list, enrollment, or payment, you can go ahead and send those to me, and I can figure out how to get those answers or who it needs to go to. And also we have the PCPCH email address, provider enrollment, several throughout the presentation that you can get a hold of folks over here at OHA. All right, so it is 8 o'clock. We're going to go ahead and let you go for today. Please stay tuned. I will be sending out an email with the slideshow and also with that link to sign up for the webinar that Evan was talking about.